Hey everyone, Dr. K here from Integrative Health Management. We have Dr. Nick back again for some more information. So he wants to do a little bit on post-operative nausea, right? So sometimes, I really work for people not to have surgery, and if you're having back pain and all these things, there are other resources, folks, to prevent a surgery and not go through that. So don't always jump to the surgery. I have lots of tools and techniques to kind of, curtail that, get you on a better path, help your body heal from it. There are ways. Let me just tell you, there are things outside of the box. So please reach out if you're on the fence of having a surgery. But there are times where things happen where you need to have surgery, like, ankle fractures and things that, even though I do work on those and I can't heal those up too. But sometimes there are emergent things where you have to have a surgery. So after a surgery, you might not feel so great because of some of the chemicals we kind of have to put in your body to keep you asleep so that we can do the surgery. And there are natural ways of kind of curtailing that and helping you with that. So please email me if you want some natural ways. But Dr. Nick kind of wants to talk to you a little more about what happens after surgery, since that is his specialty. Well, he's a wonderful anesthesiologist. So very kind to folks. So you're lucky if you have him behind the table.
And I love taking care of people. One of the things that she talked about non-surgical, one of the things I've been doing for about 20 years is I work with a number of orthopedic surgeons and neurosurgeons and chiropractors, or different medical professionals, to do the non-surgical treatment. So basically, if somebody is having some problems, I try to find some way of non-surgically dealing with it. And sometimes it's possible and sometimes it isn't, like Dr. K says. But post-operative nausea and vomiting is one of the things that I'm very, something that I'm concerned about. And it's the reason why you get that dreaded and no eating after midnight, and it's 3 o'clock and you're like, oh man, I want something to eat. And a lot of people, it's just not even the food, it's like their coffee, their morning coffee. Right. It's like, where's my coffee? So that the reason that we do that is to try to prevent the post-operative nausea and vomiting. Now, there are a couple things, and I talked about in my first talk what we talked about. We talked about reflux disease, but this one is, I just want to get a couple more details here. And I put my note to myself, spoiler alert, it doesn't make our day watching you upchuck at the side of the bed. Hey, we don't like it either. So we want to do everything that we possibly can to try and help you avoid that. Now, there are two different aspects to it. The physical is kind of, you got to go back to the first lecture where I talked about the reflux heart disease. That's a physical. I explained how the stomach is oriented and how you can physically change the things that stimulate your body to produce that nauseousness and vomiting. And you can go back to one of the other lectures and you can talk. But there is also
2 weeks ago.
There's also physiologic reasons why you may have nausea and vomiting afterwards. Okay, part of it has to do with circulation. At any one point of our existence, 60% of the circulation in your body, the blood that's circulates in your veins and your arteries, are in your lower extremities, in your legs, because you have big, massive vessels, arteries and veins that carry the blood out from your aorta, from your heart to your lower extremity. Okay, so now we have developed valves in our veins where it stops the blood from going backwards and keeps it going in the right direction. So it goes down to our legs, goes back with these valves, stop the blood from going back, and it goes back to our heart, and the circulation continues. So that's basic what happens every day. But again, the majority of it is in your lower extremities. So bring anesthesia into the picture. Those vessels that are already big get bigger, they get more relaxed, and so basically you have a large amount of circulation down in the lower extremity, which is one of the reasons why if somebody is standing for a long time, somebody at a concert, somebody doing whatever, and they faint, that's what happens, because all that circulation's in the leg. You need a certain amount of circulation in your head in order to keep you conscious. You need a certain amount of circulation in your gut. to make digestion work. So I'm going to go back on those little points there in a little bit, but yeah, basically there's a economy of circulation that needs to happen for your body to function. You need that circulation, and so like I said, you give anesthesia, it makes those arteries and those veins bigger, and so now you've got more circulation going down. Now, what your body has to do is not only use those valves, but it also has to squeeze. Now, if you have a garden hose and you just turn it on without a nozzle, it'll flow out at a certain, rate. Mm-hmm. But if you put your finger over the edge of it, you can get that hose to go, that water flow to go farther. That's what your body does. It squeezes in order to get the circulation to all the different parts of the body. But with anesthesia, it's basically paralyzing that, it relaxes the whole thing. So it's hard for your body to get. And then if you stand up too quickly, all that circulation goes down. It's even harder. So that's why, sometimes the first time when you get that nausea and vomiting is as you get up out of bed, or you get up too fast and you haven't given your body a chance to acclimatize to the change in position. If you feel dizzy, lightheaded, or nausea, just lay back down, and preferably on your right side. And you can see why on the first lecture that I talked about reflux disease. And there's some people that are going to be more prone to developing. I mentioned something called hiatal hernia. That's going to make you much more prone to developing post-op and nausea and vomiting. There's some people that react more dramatically to anesthesia, meaning that their veins and their arteries dilate. Somebody that has diabetes, somebody that has a history of a family member getting sick, you look at them, sideways, and they're like, hopefully it's not anything to do with you, but just, they just get sick at the littlest thing, go on an airplane ride, amusement park ride. So those are the questions I ask people. Do you have any, if you go on like a plane, or you do an amusement park ride, or just a car ride, do you tend to get, nauseous? Yeah. Right. And some people just have more nervous disposition than other people. So yeah, those are the things that definitely affect postoperative nausea and vomiting. Also, when you do have your surgery afterwards, you need to think about the economy of the circulation, and you need to, again, allow enough circulation in your gut in order to aid in digestion. So you want your first meals to be very small, and you want to do it very, very slowly to allow your body to accommodate to the circulation that's shunted away from your intestines. And that's the reason why, you've heard those tales about don't eat before you go swimming or something like that. And there is truth to that, because again, think about this, if you're just in foot deep water, no big deal. But if you go out deep, where you have to use all the muscles in your body in order to swim and stay alive so you don't drown, if you ate a big meal and your body has to say, okay, all right, if I don't keep the circulation going to my arms, I'm going to drown and not do so well. And I've got something in my stomach that's calling me. It's going to say, throw that out. Yeah.
Your life is more important.
Exactly. Yeah. So it's going to say, survival. I can't deal with it. Throw it out, And another way how the body's so amazing in just allowing it to basically survive. So yeah, all that stuff is just going to be a bad meal, and it's going to come right back out, just because your body can't deal with those two big demands. Many people have heart attacks and different things after a big meal for the same reason. It's just like there's an economy. And then if you throw in other things like we talked about with cigarettes and anything that's kind of diminishing your perfusion, you're basically your body saying, I need oxygen, and so there's so many different things that your body tries to accommodate, especially some of the key organs like the kidneys are very, the heart, the brain, the kidneys, they're very, very, they're aggressive for their circulation, and if they don't get it, then they start to act up and tell you, hey, listen. So again, after surgery, you need to get up slowly and basically allow enough time for your body to accommodate for the volume distribution. And you also, whatever you take by mouth, I know you're hungry afterwards and you're like, oh man, I could eat a burger now. Not a good idea. Probably better thing to have is like some kind of soup or broth, something even with not a lot of meat, just like maybe a few little vegetables, just something just to expand the stomach back open and let you, acclimatize to the circulation issues that happen as you finish after your surgery. So again, if you get up slowly. Better you lay on the right side, and and there are different medication. We obviously will give you a lot of different medication, especially if you're prone to developing that. But just having the knowledge of what's motivating and what's kind of instigating that postoperative nausea, I think is really important for you to know. And so these are the main things that I wanted to talk about there as far as postoperative.
Yeah, thank you. So if you have to have surgery, he's the guy to get all the information from. So go ahead and give everybody your email too. So if you're up for a surgery and you want some more help on preparing for it, not knowing, maybe you've never had a surgery before in your life and you're just kind of not sure, how can they reach you? All
right, my email is drnki2012@gmail.com.
Great. Feel free to reach out to him, and if you need anything from me, Dr. K at ihmohio.com, or leave me a direct message below. And we're happy to help you with any questions that you might have. And we'll have more information upcoming. So till next time, take good care and have a fantastic day.